Regardless of vaccination status, anyone inside a county building must wear a mask until further notice. This includes libraries, senior centers, and all office buildings. My hope is that other institutions where the public gathers will follow the county's lead. Now I want to talk about vaccination. Vaccination remains the most effective weapon against the virus in all of its forms. Some employers have already announced that they will require their employees to be vaccinated as a condition of employment. And others are suggesting that the requirement will take effect when the FDA use authorization is upgraded from emergency to full. President Biden announced last week that federal employees would be given the option of getting vaccinated or showing weekly proof of a negative COVID test. My team, like most large employers, has been discussing the topic of vaccination requirements for many weeks. Implementing a vaccine requirement with a testing option is complicated, but most likely effective. So I'm announcing today that all county employees must, beginning September 13th, show proof of a COVID vaccination or weekly evidence of a negative COVID test. In other words, we're following the federal government's lead as a means of protecting our public servants and setting an example to other employers. I've spoken to many of our department heads and union leaders about this, and while we understand that there will be some resistance, we expect that most of our employees will welcome this news. The message that I want to share today is not one of doom and gloom. It's a message of hope. The Delta variant is a tougher enemy, a more effective fighter than its predecessors. But our vulnerable, unvaccinated population is only 30%. We are fully capable of vaccinating everyone who is currently not vaccinated before the fall weather comes, before flu season, before COVID surge season. In other words, we can stop this thing with no new restrictions, no more threats to our economy, and very little disruption to our families. So please find someone who is on the fence or reluctant to get that vaccine and beg them, plead with them, warn them how deadly the Delta variant is, and get them vaccinated. Save someone's life. To get them started, send them to aacounty.org for all the information that they need about the vaccines and where they can get them. So I have with me our health officer, Dr. Nilesh Kalyanaraman, as well as our Chief Administrative Officer, Matt Power, who will talk about some of the implementation challenges that we face on this. Also, we have Joe Adenivola, leader of our Firefighters Union, International Association of Firefighters, Local 1563, as well as our Council Chairwoman, Sarah Lacey, who will all be commenting on this announcement. So, Dr. Kalyanaraman.
Thank you, County Executive. I'm Dr. Nilesh Kalyanaraman, the Health Officer for Anne Arundel County, and just wanted to lay out where we are with COVID. We've gotten 60% of the people in Anne Arundel, 70% of those who are eligible to get vaccinated. Maryland has one of the highest vaccination rates in the country. In our county, our daily case rate was down at 0.7 per 100,000 on July 1st, and there were only 2 people in the hospital. When we look around the country, it looks different. States like Missouri and Louisiana, they're getting hit hard by the Delta variant. Their hospitals are filling up. Their vaccination rates are much lower, which is why they're in this position. We're in a better position because we're getting vaccinated. But the Delta variant is now in our county and our state, and it's spreading fast. We've seen the case rate go up from that 0.7 at the beginning of July to 8.4 by the end of the month. That's due to the Delta variant. More importantly, hospitalizations went up from 2 to 17 by the end of the month. The Delta variant's different. We know that it spreads more quickly and is more deadly, causing more severe illness and death. What we're learning is that while the Delta variant spreads more easily in those who are not vaccinated, people who are vaccinated can also spread it. The vaccines prevent a lot of infections due to the Delta variant, but there are some breakthrough infections. But the good news is that the vaccine still offers strong protection against severe illness. The bottom line is that we've known that the Delta variant is far more severe if you're not vaccinated. If you're vaccinated, you're still much better protected than someone who isn't vaccinated. But that level of protection isn't as strong as it is for other variants, and that's the difference. What's challenging is that we've done all the right things. We're vaccinating people, we stayed masking until our case rates truly went down, and despite that, the Delta variant's spreading. The situation has changed on us, and so we have to respond to that increased threat by adding additional layers of protection. So last week, the CDC updated their guidance based on this new information about how rapidly the Delta variant spreads. In communities where there's substantial or high spread, and the CDC recommends masking in indoor public spaces, whether you're vaccinated or not. This is to reduce the spread of the virus, given how many people are still not vaccinated. For our county, when the daily average case rate goes above 7 per 100,000, that means there's substantial spread, according to the CDC. Our case rate went above 7 on Thursday, and it's now at 8.4. When you go to an indoor public place, please wear your mask. And I urge all businesses and organizations to implement universal masking indoors to control the spread of COVID. Contact tracing guidelines have also been updated. People who are vaccinated, who are contacts of someone with COVID, still don't need to quarantine. However, they will now be required to mask for either 14 days or until a COVID test done between days 3 to 5 comes back negative. Vaccines continue to be the strongest layer of protection we have against COVID. Those who aren't vaccinated are getting hit even harder by the Delta variant than by the regular version of COVID. So if you're not already vaccinated, get your shot now. It's free, it's confidential. You can get your shot at pharmacies, doctor's offices, and health department sites throughout the county with same-day availability. It's tough for us to be in this position after everything we've done to protect ourselves, but as COVID changes, we have to adapt to what we do to stay safe. So protect yourself, protect your family, get a shot, stay masked. We will get through this together.
Thank you. And I've asked Matt Power to come up. He's the direct report to all of our departments, and he's handling the logistics of implementing this as an employer. So good luck, Matt.
Good morning. My name is Matt Power. I'm the Chief Administrative Officer for Arundel County. I first want to thank the County Executive for his quick action, and also thank Dr. Kalyanaraman for his continued guidance throughout this pandemic. The health and welfare of our county workforce is central to our ability to provide programs and services for our residents. From our libraries and senior centers to our police and paramedics, we need our staff healthy and safe to do their jobs effectively. We'll be working hard in the coming weeks to implement these new policies. As we've done in the past, we'll be working across all our county government sites to ensure the message is clearly communicated to staff and the general public. Starting this Thursday, if you're indoors at a county facility, you need to wear a mask. It's business as usual with a mask. Likewise, we'll be working with our agency leadership and supervisors to clearly communicate the new vaccine policy, including details on implementation and how to get vaccinated in advance of the September 13th deadline. We know that we're up for this, and we know that our workforce is up for this. Thank you very much.
So I mentioned that we'd spoken to some of our union leaders of county employees, but I particularly wanted to have the leader of our firefighters up here, Joe Adenovola, because no group understands what this pandemic has been like better than our firefighters. So thanks for joining us, Joe.
Thank you, County Executive Pittman. My name's Joe Divinola. I represent close to 900 firefighters and paramedics from the ranks of firefighter all the way up to captain. I got to say that, this past year has been an absolute challenge for our firefighters and paramedics. There's been no other group for Anne Arundel County, no workforce that has encountered more COVID-related patients, treated them, and transported them to the hospital. And I tell you, the hospitals were overloaded. Some of our paramedics were in the unit waiting to get into the hospital with COVID patients for hours upon hours just to get them out of the unit. So it's been a challenge. As firefighters, we learn to adapt and overcome challenges. And, we take that challenge every day. There's a lot of hereditary risks, dangers in our job. We know we're going to get broken bones. We know we're going to come down with diseases, lungs, heart, cancer. We don't live very long lives, but you might ask yourself, well, why would you take this job? Well, we want to help people. At the end of the day, we want to help people. And this is all about helping people. Another thing I'll talk about is tools. Firefighters love tools. We go on the scene of a fire, we wear protective gear. We go on the scene of a motor vehicle accident, we put our vests on. And this is just another challenge that we got to adapt and overcome to. These vaccines are shown to help people live, to help people not have all the signs and symptoms of COVID. So we have to do a better job at vaccination. Please, I can sit up here and tell you stories about our guys and women in the fire department that have come down with COVID and all the challenges they faced at home. The last thing we wanted to do is, get COVID on the job and take it home to our family members. Some of them with compromised immune systems. Some of them with spouses that were pregnant at home. So, I can't tell you how important it is to get the vaccine. We need to get our vaccine rates up higher. And, we're not able to do our job if we can't come to work and we're infected with COVID. So hopefully everybody is able to get the vaccine. Thank you.
Thanks, Joe. And we will take questions in just a moment, but our last speaker that I want to bring up is the chair of our county council, Sarah Lacey. And the council, this is administrative decisions, what we're doing today, but the council has stood with us throughout this pandemic and been an amazing partner. So thanks, Sarah.
Thank you, Mr. County Executive. I came up here wearing my mask in part to show you that, I don't have to. We're standing here in an outdoor venue with a nice breeze. My hair's going all over the place. I'm wearing it anyway because I want you to remember that this mask and the reason of our press conference today about putting on our masks, this is really no big deal. The big deal is when your child who can't get a vaccine gets sick from COVID and has to go to the hospital, your grandparent, your coworkers, yourself. Everyone needs to get the vaccine, and I think masking is really just about a gesture of still saying, I'm wearing this even though I'm vaccinated because it protects you from me in case I do have the virus. And if I have the Delta variant, then I'm more likely to be spreading that to you. So I'm going to wear this out of a courtesy to you to protect you. And you can wear this to protect me and to protect everyone who can't get the vaccine. But the vast majority of people can get the vaccine. And this is not about, if we just get 1 point more than the other team, we're fine. This isn't that kind of situation. We need the vast majority of our residents and employees. If you come to Anne Arundel County to work, but you don't live here, you still need to get the vaccine. Because what's going to happen next is the thing that's keeping me up at night. This Delta variant is just 1 or 2 steps away from being able to mutate and become something that might not be able, to have the protection that we have now any longer. It might diffuse the vaccines that we have. We don't know, but we can learn from the past. We've seen that that's what happens. And if you look back at the history of polio, smallpox, chickenpox, which I got, there was no vaccine, I had to get chickenpox, but my kids are able to get the chickenpox vaccine. I want them to be able to have the COVID vaccine and not have to worry about COVID ever again. And I would hope you would all want the same thing. The time is running out to get vaccinated. Please do it now. Go today. Whatever your excuses are, your reasons, your fears, talk to somebody who has been vaccinated. Talk out what your fears are. And then overcome them, roll up your sleeve, and get the shot. Thank you.
Any questions?
County Executive, you mentioned that you don't have the authority to impose a countywide mask mandate. What would you need, and if you had that authority, would Anne Arundel County be under a countywide mask mandate?
Well, it would have to come from the governor. So when they ended the state of emergency, local officials no longer had the authority to make those decisions. I would certainly meet with my staff, our health officer, get their recommendation, and then make a decision. I can't answer that whether we would take that step. I think taking it at the county level in county buildings is a great first step, and hopefully sets an example for other private institutions where the public gathers.
Have you asked the governor to return that authority to the counties?
No, we've not. We've not. I mean, I expect that the state and most counties right now are looking very closely at what to do, because we have just passed that threshold or are just passing it. And the infection rate, the rate at which it's growing, is 1.4 in the county, 1.4 in the state. It's growing pretty much everywhere. So everybody's going to be confronting these questions, including the governor, I'm sure.
What's been your conversation with the school system about masks, and where does that conversation go from?
So actually, let me ask Dr. Kalyana to speak to that, because he's been making the recommendations to the school system. Then the superintendent takes a position based on that, and the school board can weigh in after that. But step one is the health officer.
So we've been talking to the school system and to private schools about this issue for the past, honestly, for over a month now. And we're also keeping up to date with the new guidance that's coming from the CDC last week and the American Academy of Pediatrics. We'll be having a recommendation along with AACPS in the coming days, so we'll have more then.
Yeah, so the positives, we don't get that information when we get the information about the positives, but Dr. K, if you could explain how and when that information is received, that'd be great.
So we don't have Delta information broken down by counties. We know that at the state level. And at least as of 2 weeks ago, more than 60% of all cases that were sequenced in Maryland were Delta cases. And that's been rising steadily for the past couple of months. So we expect that percentage to be larger now. In terms of breakthrough cases, once again, because we don't know the variant status, but I can tell you that about 30% of the cases that we're seeing in the county are in people who are fully vaccinated. About 70% are in those who are either not vaccinated or partially vaccinated. Right. So, I mean, it would be helpful, but I think the key is to remember that we're all, you know, there's no hard lines between our counties. So, at the state level, we're seeing spread. If we're going to see it here, it's going to be in our surrounding counties. So, I think the bigger point is about what's happening with vaccination rates and what's happening in breakthroughs. And I think that's really what we're focusing on, is that we're still seeing that there's much greater protection for those who are vaccinated than those who aren't.
I'm sure that you recognize that there's going to be some pushback on this. So as far as enforcement, if someone refuses to wear a mask in a county facility, what can you do from there?
don't you talk about this?
Sure, thank you. We anticipate some of that. Obviously, our best option is to very politely and escort those people out of our facilities. Obviously, it's a little bit easier on the way in. They need to wear a mask on the way in. If they take it off while they're inside the facility, we'll be asking them to leave our county facilities.
How about with county employees? If an employee refuses to wear a mask at work?
So for employees,
This is at their desk, walking around, anytime, once you pass the threshold.
yes, inside, the employees should be wearing their masks, business as usual, but with masks. On the employee side, obviously, if they continue to not wear masks after we've escorted them out the building and given them opportunities, there is an opportunity for progressive discipline up to and including suspension without pay. It'll be a slow progression to get to that point, and we hope that everyone works together with one another as we have in the past. This isn't much different than what we experienced previously before we had the vaccines. We're all wearing masks together and we're all protecting one another. Thank you.
Do you see vaccinations becoming a condition for employment in the future for county employees?
Well, that's what we're saying, that it is a condition of employment, up to suspension without pay is what we're saying at this point. I fully expect that come September, most likely, one of the Pfizer probably is the first vaccinations will have been approved by the FDA, so it's no longer emergency, and a lot of employers by then will have implemented similar policies, and we're seeing it happen already. I think I heard today Walmart central office is requiring vaccination as well, so we're going to be seeing a lot more of this.
Mr. County Executive, you mentioned it at the beginning about eviction help at the beginning of the pandemic. In Maryland, we're about 2 weeks away from that eviction moratorium statewide being no longer in place. About a month ago, I know this was a huge talker in Arundel County. There was a lot of applications coming in for rental assistance. Statewide, a lot of this federal funding has not even been able to reach people who need it yet. I've heard it's just hard to get people through this process fast enough. What's going on at the county level to be able to help both tenants and landlords get this money
Yeah.
in the next couple of weeks?
Yeah, we created a team early on in our Arundel Community Development Services, which is our agency that handles these housing issues, and we started funding eviction prevention before there was even a CARE Act. We used county money, and it's slow because every single case has to be negotiated between the employer, between the landlord and the tenant, and we want to make sure that if we put the money in, they're not going to then turn around and evict them later when they get a little bit behind. So we have a team of attorneys that we've brought on. We've got partners in nonprofits with attorneys as well, and it's going really well. The moratorium is really helpful, though, because if we have a glut of these cases all hitting the courts at the same time, the lawyers will be overwhelmed.
We have time for one more question, folks.
All right, we got everybody. Thanks, everybody. All right.